Well, Singapore has confirmed 12 new COVID-19 cases, and they include 3 Air Force servicemen who were in France on official duty and a Filipino staff nurse at Fong General Hospital.
The 3 Air Force servicemen are contacts of case 165, which was announced yesterday. All 4 were in France from February the 15th to the 7th of March, and they are aged between 30 and 44.
Case 178 is another imported case. He's a 37-year-old Filipino national who was in the Philippines on 2 separate occasions in February and March. Now, during his second trip, he visited a relative with pneumonia who has since passed on.
He is a family member of case 167, a 35-year-old woman employed as a nurse at Fong General Hospital. She was in the Philippines from the 11th of February to the 17th and had been at work prior to hospital admission.
4 other imported cases are case 170, a 56-year-old Indonesian woman, case 171, a 27-year-old Singaporean man who was in France as well as Spain, case 176, a 37-year-old British woman who was in Japan and the United Kingdom, and case 177 is a 26-year-old Singaporean man who was in the United States, UK as well as France.
2 of the latest cases are not linked to previous patients. Case 168 is a 47-year-old Singaporean man who has no recent travel history to affected regions or countries. Another is case 172, a 42-year-old Filipino woman who was in the Philippines.
One of the new cases is linked to a dinner function at Safra Jurong, currently the largest cluster with 40 cases. The latest is case 174, a 67-year-old Singaporean woman.
The Health Ministry has also identified a new cluster at climbing gym Boulder Plus in Kallang, and this comprises previously announced cases, case 142, 162 and 163.
2 of the earliest clusters at Yong Tai Hang and Grand Hyatt Singapore are now shut. All 12 linked cases have recovered.
Now, the number of cases in Singapore now stands at 178. 3 new patients have been discharged, meaning that 96 people have fully recovered.
The Health Ministry said the group of 4 imported cases linked to the RSAF is not considered a local cluster, which is linked in time and space. The Defence Ministry says all 4 had not returned to work since they arrived back in Singapore. 2 other RSAF regular servicemen on the same overseas duty as the affected ones have also returned to Singapore and are currently well, but placed on home quarantine as they were close contacts. MINDEF said the Singapore Armed Forces had already reduced its overseas training deployments and exercises in view of the COVID-19 outbreak and will continue to adjust such activities where necessary, depending on the conditions within the host country. All SAF personnel, both here and abroad, have been instructed to take precautionary measures, which include social distancing to mitigate the risk of infection. As for case 167, a Filipino woman who was an emergency department nurse at Fong General Hospital, the hospital said she had complied with personal protective equipment guidelines and infection control measures and did not attend to any confirmed COVID-19 patients in the last 14 days. She had traveled to the Philippines with her spouse in February and had complied with daily temperature taking and monitoring of health. She stayed home after she developed symptoms on 8th March. The hospital has since taken immediate measures, including monitoring any affected staff. It has also disinfected all common staff areas in the emergency department, such as changing rooms, toilets and rest spaces. Contact tracing is also underway.